down the body towards the feet. I'm going to do some more compressions here on the glutes. With compressions, it's extremely important to catch the tissue here and then push my weight away from her. Such that when I do this compression, you see my wrist starts with that much of an angle. As I apply pressure, the angle in my wrist gets bigger. Again, I place in the trochanter is here. I'm grounding on the trochanter, catching the muscle tissue. And once I get that sense of a catch there, I push myself away from Paula, pushing against her tissue. And it goes light, deep, deep, pause. And it's in that pause where the release happens. Good. I'm going to move down to the leg. Cream on. I start at the upper leg and move towards the lower leg. Always my goal is to apply touch that is deep and yet gentle, even putting the cream on. And I'm going back up here to the hamstrings and do the Lomilomi stroke with more focus, more intensity. You notice I'm using small strokes like an egg beater here. Notice how as I apply pressure, my elbows go from bent to straight. And my arms are reaching out of my shoulder sockets to create that sense of a deep and yet gentle touch. Long strokes. I'm going up. I'm going to come down on my knee. That's an option here. Up the IT band. From the knee up to the trochanter. And then hamstrings. And medial hamstrings. Lomi stroke to say goodbye to the hamstrings, hello to the calves. That's a transition stroke. Then I'll do the Lomi stroke again, this time focused on kneading the muscle tissue. 3 passes from the knee to the ankle. And then long strokes from the ankle to the knee. I'm following right up her fibula. I ground on at the malleolus, then apply pressure as I push all the way up to the top of the fibula, which is down here. Then long strokes up the center of the calf. And medial calf. Again, my hand is perpendicular to the muscle fibers. This round shape of my hand conforms to the round shape of her leg, allowing me to go deeper. When we go parallel to the tissue, as in this kind of move, we tend to push in with the butt of our hand and it's more aggressive. When we go totally perpendicular to the muscle tissue, it allows a move that's deep and yet gentle. And finish with Lomi stroke to soothe. Good, down to the foot. There are 6 strokes on the foot. We're starting with long strokes. Long strokes from the through the arch. I could do them with thumb, or I can do them, I'm going to pull her pillow over, can do them with my elbow. I'm using the my olecranon process here. There's there's nerves there. It's easy to have pretty specific sensitivity. And I'm going to do 3 over to the ring finger. Notice also how this hand is relaxed on her foot. If I were to bring it up, it would make a deeper more aggressive move there. But if I ground that hand, keep it soft and gentle, then my elbow stays more gentle. I'm working here on the ball of the foot. Okay, one more time. I'm going down through the arch of the foot using my elbow, my olecranon process. 3 to the big toe, 3 to the lateral side. Then little short strokes right on the ball of the foot. With this hand nice and relaxed, actually both of my hands are nice and relaxed. That's what gives me the specificity through my elbow. Pulling strokes. Right here I'm targeting the crease at the base of the toes. Catch them and then I lean back. So I catch with my fingers, then I lean back with my hips to keep my whole body protected. And then long strokes. And again, this move comes from my hips, where I'm leaning back with my hips. That keeps my hands relaxed. For a comparison, this is coming just from my toes, or from my hands, my thumb. I'm not using my hips. This is coming from my hips. Good. Deportment. It's important doing this stroke to keep your head, or keep my head aligned, straight, not to drop it to one side or the other. Keeping it straight here allows me to have even pressure through both hands. And finally, compressions for the heels. One hand goes underneath, secures the ankle, and then through the towel, which lets me go in softer, deeper, and faster, I apply the compressions. When I apply compressions, I reach out of my shoulder joint so that there's a soft sensation created by my fist, and it's safe on my shoulder, on my wrist. You notice my arm is bent here, then it straightens, and then I push. When I push, my hips go back, almost as if somebody's pulling my tail backwards. For the leg here, I start by evaluating her motion. She goes nicely, she moves nicely, and evaluating motion in her ankle. She moves, there's something slightly awkward there. I'm doing a foot toss here. And now, what I call windshield wiper. So her leg goes easily this way, which means the hip is moving this way. When I want to take her out this way, there's a restriction, so the hip doesn't as easily anteriorly rotate. These adductors here are a little tighter on this side. I don't want to open up. I'm going to take and just drop her leg on the table a few times and then repeat this movement. She's going out a little bit more. When I drop the leg on the table, it creates a deportment right on the attachments of the quad muscles where they attach into the knee. And you see now she's moving a little more smoothly in a bigger motion. Quad stretch. So the first step is to bend her knee towards her buttocks, making a nice angle or hinge right here at the knee, and then I take the slack out. And then I'm going to apply a little pressure I'm asking in my mind, is her body inviting more stretch? And then I hold it. And there's a big difference between asking, can I take her further? Or even, can she go further? Versus, is her body inviting more stretch? When I ask the question, is her body inviting more stretch, I listen in a more careful way. And we're going to end this with this foot toss.